Okay, I think actually we have a lot of folks here, so maybe we can start. And welcome. So this is a talk about dispatching. And so good afternoon, everybody, and welcome to our session, Mastering Dispatching. I'm really delighted to meet everybody here. And my name's Jing Zhu. I'm the presenter of this session. So before I started, let me get some housekeeping stuff out. So we have some swags here. You guys all see you have pens and a piece of our flyers. And then we also have water bottles in the back. And we actually carry it directly from California to here. So feel free to take some, please do, and we don't want to carry it back. And also, we'll host an ice cream social at our booth right outside Business Lounge. And feel free to join us at 3 p.m. To 4 p.m. during the vendor hours. And James, my co-founder, is going to show you how to make ice cream out of liquid nitrogen. It will be fun. We also have root beer. You can make a flow yourself. So, and then we're going to have a flag, so you won't be able to miss it. So we paid $20 to get that flag. So better use, hopefully it's good use of it. Well, dispatching is a really important topic. Probably the first question on your mind is, who are you? And what do you know about dispatching? Okay, so I'm one of the co-founder of a company called Duet. We are based in Silicon Valley, or the San Francisco Bay Area in California. We develop dispatching softwares to support and empower NEMT providers. And developing software doesn't necessarily make me a good dispatcher, right? As you all know. So we also offer dispatching services to our customers. And we have been managing about 5, soon 6 different operations in different states. So we learned tremendous of it. So we want to share the knowledge and our experience with managing those services in different states with you, and also want to learn something from you too. Well, just let me tell you a little bit how I started dispatching. So a few years back, actually 3 years back, on a Friday, one of our customers called me. She said, Jing, I really need your help. My husband is in hospital, and I have to take care of her this weekend. So can you help me dispatch my service or manage my service? I only have 2 gurney vans on the road. It just feel like hospital calls. And you have seen my service and you know it. Can you help me? I said, no, oh yeah, I know your service. I saw how you use our software. I know routing, no problem, I'll help you. So I started at 8 a.m. I'm not familiar with hospital discharge calls that time. So typically 1 call leads to 3 follow-up calls because I constantly missing different informations. And also I wasn't familiar with how much time it takes to load and unload a gurney. So I started at 8 a.m. By around noontime, we were an hour behind. And then in the afternoon, it's getting worse. One of the trips were 3 hours behind. The ER nurse was so upset, and the case managers were just furious. And then by the end of the day, oh my God, I just want to hide under a table. Oh gosh, what did I do? My customer is going to lose this account, and I will be fired by them. So I called her, I said, oh, I'm so sorry about this. She said, oh, no worries, it happens to everybody. So I will take care of it. So tomorrow, please still help me. So I was so surprised tomorrow, the same ER called again. So wow, how did you do that? So at the end of the day, I called the customer and said, what did you do? And she said, oh yeah, actually this morning I brought a lot of donuts to the ER. And I explained to them the situation. And we had a good laugh, so everything is good. Lesson number 1. When disasters or messy situations like this happen, address it right away with your client. Okay, so she is really good. She actually signed more than 30 contracts. So you don't want, customers, what worries them is not what has happened. It's whether this is going to be the experience they're going to have for the next 3 or 6 months. So you have to address right away. Tell them what the issue is and what's your solution to mitigate, so you can erase this bad, unpleasant, or pain memories right away. So lesson 2 is I realized, okay, dispatching is actually now easy. We should do better. That's how we started dispatching service. And we have been managing our customers' operations, several customers' operation in different states. So I'm going to share some stories about this. Okay, so, and then those experiences, actually, what we learned from customers is just tremendously helpful. So it really guides our product development. So what you see on the flyer, that image, that's actually our signature feature. It's a calendar view of the dispatch board, we call it. So everybody loves it. And I personally trained many dispatch services myself. And every time, actually, it's only take an hour. Next day, they're up and running. And recently, last month, I trained a group of nonprofit organization staff members. And they were actually, they are like retirees. And then they are just so scared of software. They look at software as like a tiger. So we train them. So in an hour, next day, they are up and running. So we have really friendly softwares. So, well, actually, this is the first time we came to this conference. So we actually provide airport shuttle services to some of the members. And like in the cars, yesterday we asked them, what do you like to know about dispatching? A lot of people say, oh yeah, I know you guys are software developers. Please don't sell us software. So I'm not going to tell you about too much the software part, but I'm going to focus on the dispatchings, what we have experienced by managing different operations in different states. So, well, actually before, okay, so, well, it's only once a year we'll gather in the same room talking about, to meet each other and discuss about various situations about dispatching. So I want to know, actually, we should get to know each other better. So so let me ask you some questions, okay? So if that's you, please raise your hand. And so let's start first one. So who are the transport providers? Or you work on a team of transport providers? Actually, I kind of, okay, great. Oh, really? So who are, there are only, how many? Can you actually raise your hand? If you are transport providers. Okay, great, fantastic. All right, so so how about, how many vehicles do you guys have? If you have 5 or fewer vehicles, can you raise your hand? Okay, great. And how about 5 to 20? Okay, great. And like anybody manage more than 20? Okay, great, so 5, 6. How about 100 vehicles? Anybody manage? Oh, fantastic. Okay, so are you, 400 vehicles, is all sedans or wheelchair ones or? Okay, great, okay. That's fantastic. Well, I'd love to hear some of your experience too. All right, so raise your hand if you only provide ambulatory trips. Okay, all right, okay, so we have one. And how about the wheelchairs, like among all the other services? Okay, so how about gurney trips? Anybody provide gurney trips? Fantastic, okay, yeah, so we're actually very familiar with gurney trips. So because most of our customers, half of our customers provide gurney trips and all of them provide wheelchair trips. So we got a lot of experience exposures, but I also want to learn from you guys. And who use brokers? Raise your hand. Okay, great. And so how about the direct contract with facilities or hospitals? Anybody? Okay, I'm sure there's more. And how about private pays? Anybody? All right, so do we have folks primarily focus on private pay? Nobody? Okay, all right. So one last question, okay. So how many years have you been in business? Less than 5 years, please raise your hand. Okay, so how about 5 to 10 years? Okay, and well, more than 20 years. Great, all right, so this is the person you need to take out for coffee or lunch. It really needs a skill to be running the service for 20 years. So we have customers actually in the service for 30 years. When I talk with them, they said, well, like Jing, I tell you, even though we have been in business for 30 years, every day is still a different day. So this is really an adventure for us. So, okay, so hopefully we'll learn some wisdom from you in the following talk. Well, a lot of providers, actually, especially new providers, will always ask me, so, oh yeah, is this still a good market to get in? Okay, and can we really make money in this market? Well, the good news is actually, this is a growing market. I'm sure some of you have seen those stats. So in about 10 years, we'll have more seniors than teenagers. So the silver tsunami is coming. And then in 15 years, we have the number of people who are living with a chronic disease is going to be doubled. And then the Medicare Advantage. I'm not sure you guys are familiar with that. I'm sure like some of you heard about it. Traditionally, Medicaid covers non-emergency medical transport. And the classic Medicare doesn't have a good coverage. However, Medicare Advantage, which is the new Medicare, they actually have much better coverage for medical transport. So last year, 51% of health plans adopted Medicare Advantage. So basically, sooner or later, Medicare Advantage is going to take over, replace the classical Medicare. You'll have more money from Medicare poured into this market. So together with all the other insurers. So the market is growing, which we have a lot of tailwinds here. That's fantastic. But I have to say, NEMT is not an easy business to manage. Okay, it really requires around-the-clock attention and dedication. So we have customers doing ER discharges 24/7. I have seen them for the last 2 years. They never take a break. They work through Thanksgiving, Christmas, holidays. The reason I know is because they use us for dispatching. So sometimes I have to step in on holidays because our dispatchers, they need a break. So I know them, oh, they were just so dedicated. No matter when, as soon as ER calls, they will be there within 30 minutes, an hour. No matter it's 10 a.m., 1 a.m., 2 a.m. So this is actually really, really like demanding business I have come. Customer calls never stops, okay? So, well, another thing I noticed that you really require a maniac level of attention to detail, okay? Everything counts. I always tell my dispatchers, the margin of error in this business is very, very small. Every bit of information counts. Let me just tell you a story. It happened in April to one of our providers. So they got a call from broker for an ER discharge, actually a hospital discharge, a gurney trip. They said, okay, so come to this hospital, this room, pick up this patient and take it to 90 minutes away, drop off at this facility. Everything's good. We arrive on time, took the patient, drop off on time, and then when the driver came back, the hospital called, the nurse called, said, when are you gonna come to pick up this patient? We already dropped off. No, the patient's still here. Oops, oh my God. So what happened is, well, the broker, when the nurse called the broker to book the trip, instead of room 424, they told us 442. And then when driver arrives, it's already 7 p.m. The driver has several runs. They are tired. they forgot to check with the patient. And it just happened that the nurse on duty at that time, it was a traveling nurse. And then he also forgot to check the discharge papers. And when we drop out the facility, it's already 9 p.m. The facility folks have only a couple people around. They forgot to check. A perfect storm. So what's the lesson? Always check your services. Don't count on other people to quality control your services. So you always double check, triple check. This service requires maniac level of attention to details. Okay, so well, we are in Silicon Valley. Sometimes we go to events. We talk to all the engineers. They say, oh, we're developing dispatching softwares. They always say, oh yeah, you guys must be doing routing optimization, right? So this must be a routing software. Well, yes and no. I mean, routing is really important in this business, optimization. But medical transport is so much more than just routing optimization. So let's talk about it a little bit more. So I put here, medical transportation services, 3 words. Can somebody tell me which one or ones of those 3 words bring the most revenue to us? Somebody want to give a try? Great, okay. A lot of people would think so. My mom thought about that. So, well, have you ever run into this situation? You take a call, caller said, oh, how much does this wheelchair trip cost? Got the information, so $85. What? It's only 3 miles. Why is it so expensive? Well, this patient's 355 pounds, okay? And what our driver have to do is, they go to the hospital or houses, park their vehicle, go into the room, wheel the patient out, load it, drive the 3 miles, and park, unload, take it to the clinics. It's not 3 miles. It's 30 minutes to 45 minutes, solid service. Service is what brings the most money in. So you guys all know gurney trips, right? High margin, higher pricing. Why? 2 drivers. They have to physically lift the patient, move to the gurney. Service is what brings the most money. So how about the medical part? Well, JP Morgan Chase, I'm sure everybody knows, largest bank and the financial service institute on Wall Street. A few years back, they actually got interested in medical transport service market. They actually did a lot of research to see if there's any opportunity to provide like financial product in this market. So what they found is a really, really sad and sobering fact. So a lot of folks who are sick, they don't just need 1 trip to the hospital. Many people who have chronic disease, they will use the transport 2 to 3 times a week, right? So if they have to pay out of their own pocket, what JP Morgan Chase found is 60 to 70% of those patients, they will not be able to afford after 6 months. And some of them will go bankrupt. So it's really a sad effect of reality. So that means actually the private pay market is limited. A lot of folks said, oh, I really don't want to deal with brokers or facility, business development into facility. I just want to focus on private pay. So I'm not sure actually we have any folks. Does any focus on just private pay? Okay, all right, so tell us what's the secret? What's your secret to grow, to only focus on private pay?
Well, it'd be difficult. I'm actually considering using brokers now, but that's right now, I'm just using private pays.
Yeah, private pay is really easy to start with. But if you want to grow to more fleets, more vehicles, actually, as you know, actually you need a bigger trip volume. So private pay is not enough. That's why payers have to step in. So they are the one actually subsidizing or paying many trips because in order for their members to get the care they needed in time. So those payers I mentioned earlier, those are actually Medicaid, Medicare, Veterans Affairs, Workers' Comp. There are many other transit agencies, public service agencies. We have a customer who just bought the EV recently because he wants to bid government contract. He's in LA. LA is big on zero emission. So those payers actually have come in to subsidize it. So what they are concerned is compliance and performance measurement. A lot of payers said we invested $10 million last year to get our members to their doctor's appointment on time. How come 30 of them still miss their doctor's appointment? Okay, so I need data-based validation of trips. If your drivers claim this is a no-show, they better be there at the right place, right time. And so have you guys heard about the story in Colorado last year? Anybody? Okay, so what happened in Colorado last year is their Medicaid office bumped up the ambulatory trip rate. So it's very sweet, very nice. There are a lot of more new providers come in. However, the Medicaid office or their delegates, they don't have the technology and system to enforce, to measure the performance, to enforce the compliance. So what happened is that a lot of providers, fraudulent activities become rampant. One of our providers told us that, well, one day a patient booked a trip to go to clinics using his service. And then, so when the patient come in the car, said, oh, take me to Walmart. And the provider said, no, I cannot, it's not authorized. The patient said, oh, last week, who and who took me there? So if you don't take me there, then I won't book you next time. All right, so either he has to break the law or he loses a business. That's not really a good position to be. So nowadays, brokers are pushing for digitization and integration so they can have data to measure the performance and the compliances. So I just want to go back to this. So what I've seen by working with several companies managing their services in different states is that this service actually requires a lot of skills. I want to use this slide to summarize what kind of key skills we'll need. So first of all, you need a business development and sales marketing skill. Why? You need to sell into brokers, facilities, hospitals. You also need operation skills. You need to manage transportation, dispatching, staffing, and customer support. You also need the leadership and the managerial skills because you manage drivers. You need to recruit, train, and incentivize them well so you can provide quality service. So this is not easy business. All right, so let's talk about more about dispatching. So when we started, we always ask our customers, what actually you are looking for in dispatching software or like NEMT software? They said, we actually, I have seen a lot of scheduling software, but we haven't seen a lot of dispatching software. So initially we're, okay, isn't like scheduling and dispatching similar? No, actually they are different. What do we find out? Okay, so scheduling is activities you do the day before. You have all your trips tomorrow. You know your vehicle and driver's availability. So some folks run the auto scheduler. You lay out your plan for tomorrow, and then you do manual adjustment, refine it. So you have this perfectly planned out schedule for tomorrow. But dispatching is on the day adjustment. When rubber hits the road, things can change. Well, driver A is stuck in traffic. Driver B had a flat tire. Driver C's patient is no-show. Driver D's patient came out like 15 minutes later. Well, you have to adjust, right? So that's dispatching. It's actually the most stressful activity of the operation, but also really important because it affects how much actual revenues you can make that day and affect the quality of the service and what's your future revenues. So that's what we're focusing on, dispatching. Well, there are several tools. This is the tools actually we use, really important for making a good dispatching decisions. First of all, the software is actually really designed to support dispatching and phone and messaging. There are a lot of really good messaging systems. What we have seen our customer using is GroupMe, WhatsApp, Slack, and like iMessage. So I'm not sure anybody else use a good messaging system. So this is what most of folks use. And then GPS, real-time tracking system. A lot of our software has real-time tracking, but it's based on the driver app. Sometimes you actually need the drivers in the hospital or in a facility corner which doesn't have signal, or some drivers, they're clever, they kill the app. So you can really track them. So like you do have a real-time GPS, especially dash cam, to supplement the information. Dash cam actually really important because sometimes drivers they're busy, right? They should be focusing on the patient and driving, not in the app. So they forgot to tag on board or drop off. So dash cam comes really handy for dispatcher to see whether actually that patient is in the car or not. And then it's really important for your insurance. I'm sure everybody knows that. So make sure you have the good tools for you at your disposal for dispatching. Okay, so medical dispatching is not that simple. It's not like point A to point B. It's actually, there are so many other factors affected. So I'm gonna go through some of those factors. Patient, drivers, vehicles, equipment, facility, and payer. So am I missing anything here? Anybody? Okay. Tough crowd. Okay, so I'm gonna talk about some specific challenges of dispatching. Okay, no-show. All right, no-show is really annoying. I know, like some of us don't get paid for the no-show. Okay, so what we have seen is a confirmation of pickup the day before is really important. Some providers like automated system. Okay, you blast out all the messages to patients the day before. But I have seen a lot of our customers actually like to do it personally. Why? Because they contract directly with the facility. A lot of facilities, the caregivers actually confirm the pickups. A lot of them, they will give you 2 to 3 patients for the same day. So you confirm with them at the same time. That's why it has to be personal. And so confirmation is really important, especially because there's a lot of work, right? We have seen our customers cherry pick. For instance, they only confirm the out-of-town pickups. And then within their own core service areas because it's less a waste of time, so they can cut it. But others, they confirm every single one. So how about wheel calls? Personally, I think wheel call is the most stressful dispatching I have handled. So and just happened, I don't know why, sometimes the call just come at the same time. Everybody want to go home at the same time. So you only have limited number of vehicles. Who are you gonna give the trip first? That's a very tough decision. And there's no straight answers. It's all dependent on situations. One of our customers said, I have a very clear rules. Whoever called me first, I'll give them the trip the return trip first. So can you actually give me a wheel call features like timer? So we actually have a timer so they can timestamp it and then they can show patients, okay, so somebody called you earlier. But a lot of other providers, they really based on different informations to dispatch wheel calls. I will actually have more information later. We have a little exercise, hopefully it will be fun for you guys. How about ETA request? Since we manage our customer services, some of our customer services, what we notice that a lot of times patients, somehow they think if they call you more, they'll get the driver come in faster. So a lot of times you have all those ETA calls. Where's my driver? How long do I have to wait? So they come in, it congests your phone line, and then you'll miss the important booking calls. So there are a couple of ways to do it. Once we actually developed a tracking link, which you can just message to the patient or their families, so they can track it in real time on their own, so without calling you. That's one way. Another way actually customers can set up, I see provider do is set up business systems. So when they call, dial 1 for booking, press 2 for customer service. So you can separate those two calls, so you won't miss the most important booking calls. So those are a couple things you can do to really decongest your phone calls. Oh, wheelchairs, isn't that fun? I'm sure we all wish there's only one type of wheelchairs. Life will be so much simpler. No, wheelchairs comes with all sort of flavors, right? So you have this transfer chair they call it foldable. So you can basically practically send a sedan to pick them up. You also have a regular wheelchair and the really wide wheelchairs. And then sometimes people show up with a scooter, powered wheelchair. Oh man, so that's all different because what? Because your vehicles may not be compatible with wheelchair trips. Okay, those different type of wheelchairs. We have seen like sometimes like bariatric wheelchair has to go on a lift for some customers, and then, or for other customers, it has to go on a lift, a ramp. So it's all comes from all spectrum depending on the fleet you have. And then for ER discharges or hospital discharge, when we take the booking calls, if they say it's a wheelchair trips, what's the first question we ask? Does the patient have a wheelchair or not? Why? A lot of times, patient went to ER, they had nothing on them, barely in their pajama. So even they are in wheelchair, their wheelchairs will be at home. So you have to ask, does he have a wheelchair or not? Because you don't want your drivers park the vehicle, run into the hospital, spend like 10 minutes to find the room, and realize they should actually bring a wheelchair. They have to come back and then run back. So that's an additional 20 minutes waste of time. And then they will be so mad at you at the end. So some experienced drivers, when they look at the wheelchair, they had to know whether they bring a wheelchair or not. If they don't know that message, that information, they're gonna sit in the vehicle. They're not gonna move anywhere. They will ask you to find out that information. And then sometimes you ask about whether this patient has wheelchairs. The nurse will say, oh yeah, actually we just ordered a wheelchair. Actually it'll take another 2 hours to come in. Can you actually come back 2 hours? That's why it's really important to ask this information. So how about gurneys? Gurneys also comes with different flavors. Manual gurney, which you literally drivers have to lift themselves, and automatic gurney or powered gurney, which actually you push a button, it lifts itself. And then actually recently there's a Broda, which actually I think they have a big booth. Actually we don't have customers use Broda, but I heard good things about it, so I'd love to hear your experience. So the manual wheelchair, one thing is they don't carry as much weight as a powered wheelchair. Typically, most of our providers we have seen is 300 pounds is the limit. If more than 300 pounds, they are worried their drivers will injure themselves. They will have workers' comp in hand. And then power wheelchair, the beauty is it can lift up to 600 pounds. So you can use it for a bariatric a patient. And then oxygen. When we take gurney trips, discharge trips, the next question we ask is, does this patient need oxygen? Like 10-20% of gurney trips, actually patient do need oxygen. And then you have to let the driver know so they can bring the oxygen. And just 2 weeks ago, one of our customers lost $800 gurney trips because they didn't have enough oxygen. That patient needs 8 liters of oxygen. they can only provide 3 or 4 liters. So a lot of times you can borrow from the ER or the hospitals, but that day actually the case manager somehow is very strict saying, oh yeah, actually we cannot loan it. We always loan providers the oxygens, but they never return it. So they took that gurney trip, give to ambulance. So you probably will ask, why don't you just buy a bigger tank or oxygen concentrator with higher capacity? Well, the problem is space. Okay, bigger tank or high capacity of concentrator takes a lot of space in your gurney van. You may not be able to provide certain type of trips. But if you leave it in the office, then there's another logistic you have to manage. You have to ask the vehicles to go back to the office and pick it up so you can go back to the hospital to pick up the patient. So there's always trade-offs. So how about vehicles? Okay, we'll hope we have the same vehicles, but I have never seen any providers has a uniform fleet. Everybody buy vehicles based on the availability, their budget, and what they need. So for wheelchair trips, so the vehicle also comes with different configurations. For wheelchair ones, side load, rear load, lift, ramp, they all have different capacity and different requirements. And we have customers who actually have tandem wheelchairs. They use a Caravan or Sienna. They remove the back seat, so you actually can put 2 wheelchairs. And others, we have customers. For the gurney ones, typically the good ones, the Ford Transit, you have a wheelchair and on the side, lift on the side, and the gurney in the back. So you can actually take both a wheelchair and gurney patient. So it's really nice because you can switch wheelchair and gurney trips easily. There's no additional time need. However, we do have customers who use Dodge Caravan or Sienna, Toyota Sienna. Those are really good starter wheelchair vans. So because you can actually use, they're cheaper, a little bit cheaper. You can use for both wheelchair and the gurney. But the problem with that is, the downside with that is once you do wheelchair, you have to take your gurney out because there's not enough space. So what are you going to do with that gurney? You can't leave this $10,000 piece of expensive equipment by the street side and expect it still be there once you come back 2 hours later. So you have to either go back to the office, unload the gurney, and then so you can do the wheelchair run, or you ask one of the drivers to stay with the gurney at the facility so the other drivers can take the vehicles to do the runs. So those are actually, so there's all pros and cons. So as a dispatcher, we have to know our vehicles really well in order to manage dispatching so we don't waste time. Drivers, don't you like managing drivers? I have one customer told me, Jing, I'm really hoping the autonomous vehicle will come up soon. I'm just really hope that. So actually last month I took a Waymo. You guys probably know Waymo. They run a self-driving fleet in San Francisco. It was the first time I took the self-driving ride. It was very, very impressive. Nobody in the cars, and the car knows where to pull in to pick me up and drive in this narrow San Francisco street, no problem. It was just super impressive. I'm totally blown away. However, the self-driving cars doesn't go into a hospital room to lift the patient or wheel the wheelchairs. So service, you still need the drivers to do that. So driver training is really important. So I have seen the first time I help a customer dispatch, they always tell me, okay, give this trip to the driver A. I said, why? Oh, they are really fast. If you give to driver B, he's gonna take his sweet time. It's gonna be 15, 20 minutes long, and I don't like it. Okay, great. And then when there's a bariatric patient, she said, oh, give to driver B. I said, why? Because he's stronger, so he can lift it. Know your driver well. And then after managing several operations, what we noticed that, there's some operations, if I dispatch a trip, the driver jump on it right away. leaving no time. And then the other service, we really have to give a pep talk, okay, or sometimes even motivational speech to incentivize them to go. They always say, oh yeah, why it's me? Can you give it to other person? So why am I also the last one park the van? So initially I was wondering, why is that? Then one day one of the customers said, can you help set up an automatic vehicle run report? I said, why? We can do it. Why? He said, oh yeah, actually I pay driver 2 parts, hourly rate and also based on mileage. Oh, no wonder your driver is so fast, because incentives, right? But I also noticed that, so she actually paid the driver by mileage. Then I also noticed that a lot of drivers said, hey, actually, why did you take away my long distance trip? Can you give me back? Why? Because it's so much easier to drive a long distance pickup, because you're just driving, whereas local trips, you have to lift, and the pickups is a little bit more challenging. So there are always like loopholes. So I'm wondering actually, what kind of, does anybody want to share their driver pay and with us? Like if you have a better system? No? Well, I mean, also there's a labor laws in each state. We're from California. What I noticed that in California, all the providers said, you have to give me lunch break, okay? Because like one of the providers said, I got sued like a couple years ago. One of my driver was very angry at me and then said, I didn't give him enough lunch break. I literally had to produce thousands of pieces of paper to prove I did provide the lunch break. You have to give me a lunch break, help me track it. So we add that. And then other providers I see, like in a couple states on the East Coast, they don't care. They said, oh yeah, actually they are independent contractors. So they will take a break on their own if they're idling, they have no trips. So knowing your market and your driver incentives, motivations is really important for dispatchings. So how about managing payers? Okay, so in each payer, each contract you have, it will have a different rate. So we support that. And also each payer has different payment cycles. Like a lot of providers in California told me, oh gosh, I'm so dreadful of providing trips for Medi-Cal, which is a California version of Medicaid, because they have so many reporting requirements and takes 6 months for them to pay. Well, and then I really actually like to go with the facilities, because typically it takes a couple of months for them to pay. So payment cycle actually it really depends, right? So some facilities will pay out of their own pocket, and then others, they will bill insurers or Medicaid or some Medicare, and then when they get paid, and then they will pay providers. So that's why actually it takes a few weeks or a few months for you to get paid, because it really, the billing actually, it can be more complex than this. And then also when you sign a contract with facility, you have to be careful with the terms. We have seen some facilities said, you cannot multi-load my members with the strangers. You can do it with my own member, our own facilities members. So be careful of those terms. So especially when you are doing multi-load. Okay, all right. So actually, how are we doing with time? Okay, we have still a few minutes. So what actually I prepared is a little exercise. So are you guys okay with exercise? Okay, cool. Let's start. Okay. So I love wheel call trips. It's very stressful, but it's like a puzzle pieces. You really needs to put everything together. So I set up this scenario for wheel call trip dispatching. So we have 2 patients, Samuel Jackson. Thanks, Samuel, for letting us use his name. And he's award-winning actor. Now he's a 76-year-old. Okay. And we also have Harold Pinter, who is a playwright and also actor and director. Unfortunately, he passed away already, but if he's still alive, he will be 93-year-old. Okay, so you have 2 wheelchair patients, and you only have one van left. You already dismissed all your other vehicles. You only have 1 wheelchair van left. Okay, so you have Samuel on one side and Harold on the other side.